Hi everybody, it's Monica Heltz with your daily Fishers Health Department update. Today is Wednesday, September 2nd. As you know, yesterday we moved into the yellow or moderate risk level for our COVID community risk rating scale. Our case rates and our percent positivity continue to creep downward. Our case rate is at 17.3. Our percent positivity at our testing site is 6.19%. I will mention that the Hamilton County percent positivity rate has been going up a little bit. It's at 6.5%. And again, we're looking at those unique individuals tested percentage. The state is now reporting on reporting that percentage in two ways. So we again are looking at the 6.5%, which is unique individuals tested. The state has not put up their metrics yet. They're thinking possibly on Wednesdays, but again, we haven't seen their new metrics that they talked about in their press conference last week. They're not available on their dashboard yet, so we can't be sure exactly how they're calculating those metrics until we see it in action. We are seeing an increase in cases of people in their early 20s right now. So I'm not sure if there's a common theme. I haven't found one on the contact investigation reports, but if you're in your early 20s, please know that this is where we seem to see a lot of spread right now. So use some extra caution and care, especially when considering your activities, especially when gathering with those who might be at higher risk levels. So please be careful out there. Again, we also have Labor Day coming up. So for all of you guys planning picnics and outings and that kind of thing, please just use some extra caution. We do want to try to support getting these kids in school. This is this is what our community is built on. So we want to do everything that we can to support them. We did see big increases over Memorial Day and July 4th with those outings. So again, please, if you're having a gathering, try to keep it at a reasonable level, use sanitation measures, try to keep it outside, wear masks, that kind of thing. Just use your common sense and be smart about it. I did want to also just mention briefly some information that I've been seeing going around on the internet. I think it was a misinterpretation of some data that was put out by CDC that seemed to imply to some people that only 6% of the deaths that have been reported for COVID were truly from COVID. And that is not actually what that information was trying to say. Basically, the information was saying that on 6% of the deaths that were reported as COVID deaths, and on 6% of those, COVID was the only listed cause of death. Now, normally on a death certificate, there are multiple causes of death listed. For example, someone could die of acute respiratory failure. That would be secondary to having chronic obstructive pulmonary disease. And that would be the root cause could be COVID-19. So COVID-19 triggered their acute respiratory failure that was complicated by the fact that they had COPD. So they maybe wouldn't have died then had they not had COVID-19. All of us, of course, are going to die eventually, but COVID-19 was then the root cause of death, but there will be multiple other causes of death listed on their death certificate. So this was only saying that in 6% of the cases, COVID-19 was the only listed cause of death. We know that this infection can be quite serious and quite deadly, and that's why we're taking it so seriously. So we also know that although we've had 180,000 deaths reported in the United States so far due to COVID-19, we have over 200,000 excess deaths this year. So above and beyond what we would normally expect in a given year. So I know that this sounds kind of morbid and crass, but I just want you guys to understand kind of how these numbers play in, and that you have to really use caution when you're interpreting them, and you have to kind of understand how the system works. So be careful what you read out there. I appreciate everybody, using their critical eyes and giving us a hard time about our data, but you need to, kind of look that way at other sources too. So thanks so much for listening. Goodbye.